Well, I guess do you have any advice for potential new grads or physicians who are looking for a switch up here? It sounds like you're thoroughly enjoying your position, no regrets, loving it all the way.
Yeah, I mean, I don't. My only advice would be to for people just to, when you start off, don't commit to anything. Um, Explore around. Like people always say, like, I tell everyone like locums are a great opportunity for that reason, is that you can kind of like see how a place kind of like functions, and if you like it, you can kind of like,
Hmm.
dive in. And that would be the advice that I would give to people is, I mean, here there's no locum, but you can kind of like, the nice thing about this job is that you can kind of try it out and see if you like it. Um, my experience was that a lot of times the way a clinic or your the way the like the patient population and everything else in the clinic, the way it was presented early on, and the way the team functions is a lot of times different in practice than what you get told. And so you end up sometimes having surprises that are good and sometimes surprises that are not so good. And that's why it's good not to commit to anything early on, especially like the nice thing about being a physician is that you can kind of choose to work anywhere you want, and you have so much opportunity. And so, don't commit yourself, especially when you're just starting. Find a place also um, that is willing to like give you good support in terms of like, more senior staff, where you have a very like collegial team and people are willing to like help you out. There's even after residency, there'll be a lot of things that you still don't know, and even like, years on out, you'll still be learning new things every day. So it's good to have that supportive environment. And yeah, don't jump in. Just search around until you find it, and once you find it, it's not then you can take that plunge.
Yeah, you'll know, right? Like once that specific spot where you find that good fitment hits, right? So you just not being afraid to like test out some different
That's
waters and
right. But
try out a few different
that's
things.
right. I will kind of say like there was such a funny difference between like when I was an engineer, when I was applying for jobs, I had to like sell myself. In medicine, it's like the only question is kind of like, do you have a valid like license? And after that, they're like selling themselves to you, So like, so you do have a lot of
The
like,
number of clinics I've worked at with no contract, they haven't checked my credentials. They just sort of, you look like a doctor, they take your word for
yeah,
it, and
yeah,
they're desperate. It's crazy how that's the state of the system right now.
that's right. So that's right. So make it as a new grad, like make sure that you're happy with what you have, and you can find the kind of like work like balance that works well for you. And that was the other thing for this job, right? So originally I thought I was just going to be like working. I wanted to work like a busy rural practice nonstop. And then when I had my kids, and when they were like, they're still toddlers and little, I kind of decided to like, like working just, you know, Cali in sort of like 7:30 to 4. And that's good enough for me right now. And I get to like see my kids, and um, they're pretty soon they're gonna get older and they're gonna have their own things, and I can add other responsibilities on, but like I have that flexibility to kind of like, you know, see them and still make a competitive wage. And so it's pretty great.
Did you have the opportunity to do part-time stuff, or is it sort of you're all in full-time or nothing? Could you go sort of in that middle ground?
I started part-time. Yeah, I started part-time. And there's some people, actually, a lot of people sometimes will start, they'll tell them like, all we have available is like 1 day a week. And so there's been some people that wanted to work full-time, and they started off with 1 day a week. But I mean, if you're interested in working more, it won't be long before that opportunity becomes available.
It'll grow on you, it sounds
Yeah.
like. Very cool. All right. And then, so parting wisdom for the audience out there. What is Dr. Ivanecki's top wellness tip? How do you keep yourself going? How do you keep your head level?
Um, yeah, that's a great question. You know what? Like my top wellness tip, I used to have all these wellness tips until I had my kids, and then it just became like try to get like 5 to 6 hours of sleep if you can. And that's like that's the threshold right now that I'm trying to meet. So
Just hit that
that's
basic minimum function. Don't go back to like the 3 to 4 hour
that's
med
right. That's
student
right.
sleep load. I'm Dr. Jordan Vollrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.